Hi, this is Kara Rose Atkinson, president of IE-CAMFT, and I'm here today with Hannah Herkert to discuss her upcoming presentation on March 26th from 9 to 11 at IE-CAMFT. Hannah, would you be willing to tell me a little bit about yourself?
Yeah, hi, thanks for having me, Carol. So I'm Hannah. I am a licensed mental health counselor up in the state of Washington.
Mhm.
Uh, I'm also a handler for what's called a facility dog. His name is Bruce. You can see him here behind me joining us.
Mhm.
Bruce is an expertly trained facility dog who works for the Lake Stevens School District, specifically the middle school up here in Washington.
Where's that near, by the way?
We're like 30 minutes north of Seattle.
Ah, got it. I've got a dear friend. Well, my best friend lives in, oh, I can't remember the name right now, but it's somewhere like that too, not that far away. What are you going to be talking about with our training? Because I'm really excited about the idea of looking at liability and, is it okay that my dog comes? Because my dog has been coming anyway.
Right. And so it's really important to start looking at things like that. I think, especially now with the pandemic and so many of us working from home, we've gotten very used to our canine companions. And so we want to continue working with them. So we're going to touch on those top. We're going to talk about liability. We're going to talk about the different kinds of dogs. There's a lot of words out there: therapy dog, facility dog,
Yeah.
dog assistance dog. So we'll cover all of those bases. We'll even talk about what happens when a client brings a dog into their session with you, and what you can do in that kind of situation. We're also going to touch on, once you have the dog in your office, what do you do with it? So there's lots of different skills and activities you can use your dog for. So when I think about it, there's kind of two journeys we can take. There's the journey of, I want to work with my dog. I want to bring my dog to work with me. And we'll talk about that journey. And then there's the journey of, I want to provide canine-based therapy with my
Right.
clients. And that's a different kind of journey. And we'll talk about that one as well.
So we were talking about earlier today about why I got into this. Why did you get into this?
Yeah, so that's a good question. So I was responding to a natural disaster that our community had had years and years ago.
Mm-hmm.
And I saw dogs working, and I saw what they provided to people, that was just this extraordinary calming gift and presence that in the middle of an actual crisis I just didn't think was possible, and the dogs created that space, and I thought I'm gonna do that. So I reached out to CCI, the organization I'll tell you guys more about. They provide assistance dogs to people with disabilities at no cost. They also breed and train these facility dogs as well, so we'll touch on that. um,
What's the
but
name
I mean,
again?
it's Canine Companions for Independence.
Oh, it sounds
They're,
wonderful. Yeah.
yeah, based in Santa Rosa, so a little bit
Mhm.
closer to you guys than they are to
Right.
me. Yeah.
So my story, I guess, is that I was telling you
Yeah.
that I was worrying about my dog because she's a little escape artist and she was always leaving. She almost got hit by a car. I had people drop her back off. Some people took her to their home and she had a playmate. But that was always in the back of my mind when I'm sitting there with the clients is my dog okay? So
Right.
once I started bringing her, that was gone. Then I could control her behavior in the office, but I didn't have to worry about her getting hit by a car.
Right.
So I guess we all bring our dogs in. You say you talk about the whys, and
Hmm.
that's got to be a different story for everybody.
Yeah, I think so. And that's what I'm learning the more and more I talk with people who are using their dogs in practice or bringing their dogs to work, that there's a lot of different whys. Um, Naturally, dogs are therapeutic. There's just no getting around it. No matter the mood they're in or the behavior they're showing, they are of
Right.
therapeutic value to the room, no matter what. Uh,
Right.
and
Keep talking.
yeah, dog owners know
She
that.
came
We know,
back.
hi, Duchess.
I told you she'd come back.
Yeah.
She wants to hear.
Yeah. So we know that about our dogs, right? We know that everybody loves dogs, which actually isn't totally true. So we'll talk about that as well.
Right. People are allergic or scared.
Allergic or scared or
Mhm.
just don't want a dog in the room.
Mhm.
Uh, there's things that come with dogs that aren't always like lovely, like the smell,
Right.
pet tummies, yeah, things like that. And so it's not always wonderful. And so we'll touch on that as well.
Yeah,
That being
that's a good point because not every person, there's been times that people didn't want her in, and she had a bed up at the reception area, so I just bring her there, but she, keep trying to get in my office.
right.
So that can be a little frustrating, but they get a choice. I mean, what if they don't want that? So are you doing that on your informed consent then?
Yeah, so there's your office policies and informed consent conversation. It should always be part of that intake process, you know. That's how I start a lot of my conversations. Hey, I have a dog in my office. Let me tell you about him. How do you feel about dogs? These are things he does, these are things he doesn't do. Um, you'll get hair on you, right? That's something I am really clear to share with people. There's a lot of hair in my office. I don't vacuum between every single client. um, and I would say 95% of the time, they're like, you should see my house, right? Um,
Exactly. But I've talked to Jill Johnson Young because they bring dogs to Central Counseling, and she has cancer.
mm,
So, which doesn't mean that it's not bad, it's not aggressive. It's, she's had it a year. They're really not seeing much with her.
mhm,
But at some point, there's a conversation of grief and loss.
mm, mhm. Of losing your office animal or therapy pet. Yeah, that's a good point. That's something I don't want to think about, but
Right.
that's a very good point. Yeah.
Well, Jill told me that she brings it into session and
Mm,
they have a discussion about, like, her dog gets cancer. A lot of dogs are getting cancer these days, and we don't know necessarily what it's from. Is it the shots? Is it, environment? Who knows?
mhm.
But actually, she's found it very useful to help clients walk through grief and loss in their own lives.
Yeah, I can imagine. And I would say the whatever's brought into the room, I mean, that's can be part of the work, right? And so there are times, not with cancer or illness, but there are times with Bruce. Hey, Bruce, wake up, come
Yes, Bruce, we need you.
here. There are times when
Oh,
he's like not, in the best mood. He's not perky, his tail isn't wagging, he's just kind of chilling out. He's more relaxed. And so talking with kids or clients or patients in the room in that moment of like, well, what do you get when you're like that? When you kind of like just
mhm,
face away from everyone and look at the wall, because that's what
right.
he's doing, right? Um, yeah. And so like, what do you think he's feeling right now? What do you think he's experiencing right now? And just bringing it into this space.
Do they project their feelings onto the animal, do you think?
I mean, it still continues to surprise me when a kid, a student, or a client will walk in the room and they'll say, "He looks upset," right? And to me, he's just like there, and I'm like, "Oh, well, tell me more about that. Why does he look upset? I don't know. Maybe something happened. Maybe he's bored. Maybe he's tired of Zoom. Maybe and then they'll start to kind of formulate that story. Um, yeah.
I
So yeah.
mean, all the interventions are so amazing. Like anything just can come at a dime, how you can use an animal or anything. Sometimes you use stuffed animals as well.
Yeah.
So please give your website so that they will know that. I'm going to also, be posting that. But what is your website?
It's hannahherkertcounseling.com it's a private practice that I run, but I do work full time for the school district. And so I want to add too that in the presentation, we're going to talk about things that you can do if you're school or facility based, like if you work at a school or a hospital or an agency. So activities with your dog that you can use with larger groups of people. And then I also have that private practice lens that we can look at as well.
Right.
Mhm.
So you said you worked with kids like middle school?
Yeah, so I primarily work at the middle school with 6th and 7th graders, but we visit the elementary schools a lot, which this is recorded, but it might be my favorite. If you take a dog into an elementary school, you are the most popular person there. I
Oh,
will
yeah,
say.
yeah, yeah. I understand. Every time we walk our dog, it's, it's a conversation.
Yeah.
Yeah.
Yep. Definitely. Yeah.
So,
So, oh, go ahead.
so you have that website and they can reach you through that if need be.
Yes, you can contact me through hannahherkertcounseling.com. I'm sure my name is spelled somewhere on your Facebook.
Herkert.
Yep, that's it.
Wow. Okay, good. All right. So with that said, I will let you go, but I'm really looking forward to introducing you on March 26th at 9 to 11. If you're a guest and not a member of IE-CAMFT, you are welcome to come. It's $20. And, the subject is so relevant. A lot of people are really interested in this. So please share. And we look forward to seeing you at our training. So with that said, have a great day and please stay safe.